Welcome back to DataRx, where we break down the power of data in healthcare. In our last episode, we explored the foundation of the data hierarchy, how raw information transforms into actionable insights. But data isn't just numbers on a screen. It influences real-world decisions, from medical treatments to government policies. Today, we're applying that framework to mental health. Ever wonder why mental health policies vary so much? Or how funding decisions are made? It all starts with data, how it's collected, analyzed, and ultimately used to shape decisions that impact millions of lives.
Today, I'm diving into a topic that's super important yet often overlooked: how data shapes mental health care. Every decision in healthcare starts with data, and mental health is no different. But how do we actually measure something as complex as mental well-being? Let's break it down. First off, we have electronic health records, or EHRs. These are gold mines of information containing official diagnoses, treatment plans, and prescription histories. But there's a catch. They only capture individuals who have sought professional care. That means many cases go undocumented, leaving gaps in our understanding. Next up, insurance claims and billing codes. Now, these might sound boring, but they're incredibly useful. They show us which treatments are being used, how often they're covered, and highlight gaps in access. If people aren't receiving therapy because of high costs, the data reflects that, making it easier to advocate for better coverage. Then, we have large-scale national surveys like the National Health Interview Survey. These self-reported surveys help estimate the prevalence of conditions like anxiety and depression. They fill in the gaps where medical records fall short, but they're not perfect. Bias in how people perceive and report their symptoms can skew the data. Now let's talk about some newer sources of data. Crisis hotlines, social media sentiment analysis, and even wearable devices are providing real-time insights into public mental health. But these come with their own ethical challenges. How do we balance useful insights with personal privacy? That's a question we're still figuring out. The point is, mental health data is powerful but fragmented. The real challenge isn't just how we collect it, it's how we process, interpret, and use it to create meaningful change. Whether it's improving access to care, developing new treatments, or just understanding mental health better, data is at the heart of it all. So, next time you hear about mental health statistics or new treatments, remember the data behind those numbers. It's not just about numbers on a screen, it's about real people and real lives.
Once collected, raw data must be processed and analyzed to make it useful. But mental health data poses unique challenges. Mental health records often include unstructured data, like therapist notes and patient self-reports, unlike structured medical data, such as blood test results. Analysts rely on natural language processing, or NLP, to interpret these records. For example, NLP can scan physician notes to detect patterns in anxiety, depression, or PTSD cases that might not be visible in structured data alone. Beyond NLP, machine learning models help detect hidden trends. A predictive model, for instance, can estimate where suicide rates may rise based on economic downturns, social isolation, or increases in crisis hotline calls. But there's a major ethical concern. If these models aren't trained on diverse data, they may reinforce existing biases in mental health care. Another major challenge is data privacy and security. Mental health data is among the most sensitive types of health information. Regulations like HIPAA in the US protect patient confidentiality, but as mental health tracking shifts toward AI-driven tools and digital therapy apps, ensuring privacy remains a pressing concern. So how does this data influence real-world decisions? Governments use epidemiological data to allocate resources. If data shows rising rates of depression and anxiety in a specific region, funding may be directed toward expanding psychiatric services or crisis intervention programs in that area. Insurance companies analyze treatment outcomes to decide what gets covered, but this can be problematic. For example, if insurance claims data shows that fewer people complete long-term therapy compared to short-term treatment, insurers may favor short-term therapy coverage, even if long-term therapy has better clinical outcomes. Even big tech companies are using mental health data. Platforms like Google and Facebook have experimented with AI-driven sentiment analysis, scanning search trends or social media posts to identify mental health risks. While this can help with early intervention strategies, it raises concerns about data ethics, privacy, and consent. Despite growing recognition of the importance of mental health, funding remains disproportionate compared to physical health care. The U.S. spends far more on emergency psychiatric care, such as inpatient hospitalizations, than on preventative services like therapy access. This reflects a reactive approach rather than a proactive approach that could reduce long-term costs and improve outcomes. Here's a stark example: preventative mental health services, such as regular therapy sessions, cost significantly less per patient than repeated psychiatric hospitalizations. Yet, therapy remains underfunded, and many patients must wait months for appointments due to shortages in mental health professionals. In contrast, countries with strong universal mental health policies, such as Sweden or Canada, take a different approach, investing more in early intervention programs, digital therapy access, and community mental health services. The data overwhelmingly supports this model as more cost-effective and beneficial in the long run. Looking forward, AI is poised to play a larger role in mental health care. AI-driven therapy apps, mood tracking software, and real-time monitoring tools can expand access to care, especially in areas with mental health provider shortages. But this raises an important question. Can AI replace human therapists? While AI chatbots can provide immediate support, studies suggest that human empathy and therapeutic relationships are still critical for effective mental health care. However, hybrid models, where AI supports therapists by analyzing patient data and tracking progress, may be the future. One major area to watch is the use of predictive analytics in suicide prevention. AI models can flag at-risk individuals based on their online activity, but the ethical concerns are immense. Who decides when intervention is necessary? How do we balance helping people with respecting their privacy? These are questions policymakers and researchers are actively debating. From collection to decision-making, mental health data is a powerful force, but it's not always used effectively. What do you think? Should data drive funding decisions, or do policymakers rely too much on statistics over lived experiences? Let's start a conversation. Drop your thoughts in the comments. And don't forget to like, subscribe, and hit the bell for more deep dives into AI, healthcare, and the power of data. Thanks for watching DataRec. If you'd like to see how I created this real-life avatar of myself to create my videos, you can watch the how-to episode I uploaded yesterday.